Hey, this is Dr. John Mark Chesney. I'm a licensed physical therapist and owner of Simply Physio. Today we're talking about knee meniscal tears. Do you think you may have a meniscus tear? So I want to go over 4 tests that you can do on your own to determine if there's a strong likelihood associated with you having a meniscus tear. But first of all, meniscus tear, they can develop from a traumatic injury of the knee, twisting or hyperextension, but oftentimes they develop just over time, and it can be kind of a gradual process. So it may not be attributed to one certain event or injury. So, but the 4 tests, if you have 3 of the tests, there's actually a very strong likelihood of a meniscus tear. And if that's the case, then what I would encourage you is to either talk with a physical therapist, talk to your doctor. You may want to get an MRI to confirm this. So the first one is if you have a history of the knee popping or locking. So if that's the case, that would be the first positive sign, so of the first symptom. So the second one, I'm going to show you my joint line around the knee. So let me roll up my pant leg here. So you may be able to find yourself the joint line. So if I come in here, I'm on the lateral part of, or the outside part of my knee, the lateral part. So I am palpating the lateral meniscus. You have a meniscus on the inside part, so this would be the medial side, and this would be the lateral side. So with my finger, if I'm on the bone of the femur, there you go. If I'm on the bone of the femur, if I drop down, there should be kind of a little divot, a little depression, and it feels a little gummy in there. And so that's my lateral meniscus, and I can trace kind of around towards the outside in between the 2 bones of the femur and the tibia. So if I'm down a little further, I'm on the bone again, drop here in the middle, and I'm on the lateral meniscus. So we're looking to see if there's tenderness there. Same thing here on the medial side of the knee. Again, I can come here on the inside. I'm on the bone. It's hard. I'm dropped down just a little bit, and now there's a little divot or depression, and I can feel around, kind of coming horizontally around the knee to see if there's any, again, tenderness around the joint line. So if you have tenderness along the joint line, then again, that would be a positive second test. The third test, what we can look at is if I straighten out my knee. All right. So my knee's straight right here. So I want to see if there's pain with forced hyperextension. So what I'm doing is I'm just pressing the knee. So I'm going down towards the ground, trying to further straighten out the knee. So if I have pain as I try to forcibly kind of push down on my leg, that would be the third positive test for this combination of test series. So that's the third. The fourth one is just going opposite. So I'm coming up into flexion, and I'm doing forced flexion there of the knee. So that's the fourth one. There's the fifth one. It's called the medial McMurray's test, but that one's really, you can't do on your own, so don't worry about that one. But if you do, again, if you have 3 of these tests that are positive, there's a strong likelihood associated with a meniscal tear. If that's the case, go talk to your provider, physical therapist, or see if you can get an MRI to confirm that. Thanks, guys.